Hi, Deb. Hi, Missy. Hi, Meredith. Can you guys hear me?
Yes.
Okay, perfect. Oh, look, it looks like there's Amy. Hi, Amy.
Hello. Can you hear me? Am I on mute?
Yeah.
Yeah.
Okay, I think that everyone but Sarah's on. I know Kelly said she had a conflict, so we might give Sarah another minute and then I'll go ahead and get started. All right, we'll go ahead and begin. I don't want to take up too much of you guys' time. I really appreciate everybody getting on the call. This is just an opportunity for me to present the information that I have found in my research project for my bachelor's degree program. So my name's Jessica Martinez. Most of you already know me. I started working at Memorial as a practice manager in December. But today, like I said, I am here with you guys as a student. That way I can present my capstone research project. So I think that I will share a little bit more about myself and why I feel so passionately about community health. So typically I keep my personal life separate from my work life. But I think it's important that you guys have a little bit of background. So I was born in Washington, Indiana, and I actually grew up in Linton in Greene County. And my mom was a single mom, and I have 3 siblings. So when I think of memories about healthcare,
Jessica,
can you hear me?
you keep fading in.
Okay, let me see.
It'll be perfect, and then we'll miss some words.
Okay. Is that better? Can you hear me now? I'm wondering if it's my internet connection.
It almost sounded like that.
Okay. Please stop me if you notice that again.
Okay.
All right, great. So like I was saying, my mom was a single mom and I have 3 siblings. And whenever I think about healthcare experiences from my childhood and my younger days, there are actually very few and far between. And so my mom put herself through 2 college degrees while we were kids. And it wasn't until she got a job working as a physical therapist that
Jessica, it is doing it. I think it's making a funny ding. So I think it's internet related.
let me see. I don't know if I can, like I'm sitting right by my router here. I don't want to do that. Okay. I'm just gonna move over here and see if that makes a difference. Okay. Okay. Can you guys hear me?
Yeah, right now we can.
Okay, hopefully it'll stay good. So like I was saying, whenever I think about healthcare experiences as a young child, there aren't a lot of them. I don't have a lot of memories. We didn't go to the doctor a lot, not unless we were sick. Same thing with the dentist. We lived in low income housing. So the reason that I bring that up is because we're going to talk about a lot of data and statistics today. And I just think it's important that, while numbers have inherent values, that we remember that they're actually people and patients that we're discussing. So, what is community health and why is it important? Community health is a focus on the maintenance, protection, and improvement of the health status of certain population groups and communities. And a focus on community health can help reduce gaps in healthcare. So the CDC suggests that organizations approach community health with 4 things in mind. What affects health? Where is the area of the greatest need? Who are stakeholders? And how should we begin so that we can make the biggest impact? So therefore, we must first consider the social determinants of health and how they relate to community health. Social determinants of health are the economic and social conditions that influence individual and group differences in health status. These can include items such as access to education, access to healthcare, an individual's neighborhood, built environment, and the connections in one's community and socioeconomic status. So as we all well know, rural communities are disproportionately impacted by social determinants of health, and they often experience significant health disparities. Federal and state agencies, membership organizations, foundations, all work pretty vigorously to try to reduce these disparities and improve the health and overall well-being of rural Americans. But despite these efforts, we still have shortfalls in healthcare, and it continues to be an issue for populations in rural communities. Over 15% of America's population is actually impacted. So for my capstone research project, I decided to focus on an issue that had the potential to give a little bit of valuable insight to Memorial. Of the 9 counties that are serviced by Memorial Hospital and healthcare centers, I identified 4 counties that fall beneath the 50th percentile for health in the state of Indiana. So these 4 counties were Pike County and 47th out of 92, Martin County at 50th out of 92, Orange County 79th out of 92, and Crawford County coming in last for health outcomes in the state. I researched the trends that are affecting the health of these counties, as well as some potential solutions that could potentially improve the health outcomes for people living in these areas. So my first point of reference was the University of Wisconsin's Population Health Institute County Health Rankings and Roadmaps program. This program was actually created to help improve health outcomes for all and to close health disparities between those with the most and least opportunities for good health. So the program uses data collected to measure the health of nearly all counties in the United States, and it ranks them within their states. So this information actually should be familiar, as some of it was included in Memorial's most recent community needs assessment. So of all 4 of these counties, they share shortfalls in a few measures. Each county has a 25% incidence or more of adult smoking behavior. There's a 32% incidence of obesity. In addition to these health behaviors, there's an issue with access to primary care physicians. The top performing counties in terms of health outcomes have a ratio of 1,030 individuals per physician, and each of these 4 identified counties have a population to physician ratio that is double or even triple this number. Also, the incidence of children living in poverty in each of these counties is higher than that of top performing counties in the country. Pike and Crawford counties also have a significantly elevated rate of hospital stays for ambulatory care sensitive conditions. So these are health conditions that can be successfully managed in a primary care setting. According to the Health Care Cost and Utilization Project, 3.5 million preventable hospital stays in 2017 accounted for $33.7 billion in aggregate cost. And this comes out to roughly $9,628 per preventable hospital stay. This rate of potentially preventable stays from the lowest income communities is actually more than twice as high as the rate among patients from higher income communities. Heart failure, diabetes, and COPD were the three most common and most expensive reasons for potentially preventable inpatient stays among adults. Chronic diseases are the most common, the most costly, and the most preventable of healthcare problems. They're also in the top 6 out of 10 causes of death in the US. So what can organizations like Memorial do to help try to address these issues and improve the health of their communities? So according to the CDC, communities with high rates of potentially preventable hospitalizations might see the benefit of investing in primary care, care coordination, and community health worker strategies that can lower inpatient costs. So what is a community health worker? A community health worker is a frontline public health worker who is a trusted member of or has an unusually close understanding of a community that they serve. This trusting relationship enables them to serve as a liaison between health and social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. Community health workers can engage in advocacy, outreach, and enrollment, navigation, education, health services, and social emotional support for patients. Through this work, they can focus more on public health. So these experiences that they have directly with patients actually allow these individuals to identify shortfalls in care within their communities. And they have the knowledge to weigh in on the design and administration of public health policy. They can analyze health research and communication skills they use to manage projects and educate the public. So there are undeniable benefits of healthcare organizations engaging communities and promoting health and well-being. Utilizing community health workers as a part of an overall plan is a wonderful way for organizations to continue to work to eliminate social determinants of health that negatively impact the patients they serve. And one thing that's great about a community health worker is that it's a 4-week certification program that costs roughly $1,200. So an organization like Memorial could cover the cost of 29 community health workers, getting current employees already certified, and that would be about the equivalent to hiring one new employee at $35,000 for a salary. So another innovative way that healthcare organizations can improve upon community health is mobile health units. So these are innovative approaches to improving health outcomes. They're actually vehicles that are customized with medical equipment and staffed by medical personnel to provide health services to at-risk populations. Studies show that mobile clinic programs can be cost-effective in providing annual savings on aggregate costs for healthcare organizations. However, the capital investment for mobile clinic programs and the operating costs can sometimes be significant. Limitations of mobile health clinic programs can include the financial capacity, information management capacity, and staffing recruitment. Also, planning a mobile clinic program involves multiple stakeholders from private, nonprofit, and public sectors, which is a level of complexity and management that these programs experience that isn't always seen In order for this method of healthcare delivery to be successful, there has to be significant buy-in from the community. However, if these constraints can be addressed, mobile units have the potential to be a vital link between at-risk communities and clinical care. And another way that organizations can improve community health is by focusing on and increasing the utilization of home care services by patients. So according to Medicare, home care is a less expensive alternative to traditional treatment in a facility. Some of the skilled services that home care agencies are able to provide include wound care, patient and family education, intravenous and nutrition therapy, injections, and they're also good for monitoring serious injury or poor health status. Home care empowers patients to learn to care for themselves at home, and it gives their families the tools needed to support them. However, like everything else, there are some barriers to home care that organizations should be very aware of. There is a lack of supporting infrastructure such as DME companies, mobile labs, radiology, medication delivery. Patient safety also has to be a primary focus. There are very specific risks for patients in a home care setting, which includes infection control, sanitation, the physical layout of their home, challenges with caregivers, balancing patient autonomy and risk, and lack of continuous health monitoring. Another barrier for home care is the regulatory environment. CMS has rules for home care services. However, there is not a significant governing body for these. So care that's provided to patients who have commercial insurance or replacement plans do not receive much scrutiny. So there is concern for the quality that's provided through these home care services. And I included this quote: "Work and live to serve others, to leave the world a little better than you found it, and garner for yourself as much peace of mind as you can. This is happiness." So that's all that I have on that. Unfortunately, this is a really broad topic. I could honestly, we could talk about a million different things that can go into it, but I had to limit the scope so that I could accomplish this project in a limited amount of time. So does anybody have any questions? No?
Jessica, I don't have any questions, but great work and very detailed thought process as you were putting that together. That's very obvious. So thank you.
Thank you, Sarah. I appreciate that.
Yeah, I've always wondered about community health workers and why they're not utilized more. It's sort of like, to me, almost like the CASA program for children.
Right.
But it's more it would be more widespread for everybody. But yeah, when I studied my master's, I always wondered why community health workers weren't more utilized.
I've actually been researching them quite a bit, and I did read also that there are some organizations that are so tied just with the physician shortage and, you know, the healthcare worker shortage in general, that they're actually utilizing these workers to kind of serve as a link between patients in the interim while they're waiting to get care. So I think it's really interesting. And I've researched the programs a lot in the certification, and, you know, for a 4-week program and the cost, I feel like, and I actually did look in Memorial, I think we only have one certified community health worker in the organization. I could be wrong. But I searched on the hub just to see, because I was interested. So I think maybe that is something that, you know, we could eventually maybe look into if people are interested, because I think that would be a great benefit, you know, to at least have one in each county that kind of knows the area and what's going on and what the resources are for patients.
Well, we do have the parish nurse program through the foundation that would be closely tied to that.
I was thinking about is the employee or our caregiver that you found, Jessica, was it the one that's related to the perinatal services grant? Is that Crystal Loya?
I believe so.
I wondered, that was what was sparking my thought. Is it are community health workers sometimes tied to, grant situations when you're working on a very specific piece of something that you're trying to solve? In this case, for them and their grant, infant mortality is what they're obviously trying to combat with some of what they have. So I didn't know if it was tied to things like grant and things like that, but that's definitely an interesting topic. Sounds like you could use those for a whole host of issues, right?
Oh, yeah, absolutely.
Very cool.
Well, thank you guys so much. I really appreciate you hopping on. I know this is kind of taking up some time in your workday, so I won't keep you guys any longer, but I really do appreciate you guys. And I'm really grateful to be a part of Memorial, and it was, really interesting to me to be able to do this research project and kind of learn a little bit more about the communities that we're serving. So
Well, good job.
Mm-hmm.
thank you guys. Everybody have a great day.
Too. Thanks so much.
Yeah. I think she just said thanks. Thank you.